Good evening, Dr. Upendra. How are you today?
Good evening, Adarsh. I'm very fine and hope the same for you.
I believe you're from the 2008 batch of IIHMR Bangalore.
Yeah,
right?
yeah, sure.
May I know about your experience with IIHMR?
Yeah, it was a very rich experience, very life-changing and very vibrant experience with IIHMR Bangalore. Because I am from very humble background, and my primary and secondary education was in government Hindi medium government schools, and then I did my graduation in Ayurveda in Tier 3 city, Jabalpur, MP. So from a village to a Tier 3 city, and then coming for a post graduation in Bangalore Metro, and just a renowned IIHMR Institute. That was on that time, it was in number 1 ranking. There was always a tussle between TIS and IIHMR. So when we were studying, IIHMR was in number 1 ranking in field of hospital management. So I was searching in my career, in clinical career, what is happening. There are so many types of people coming and treating the patients. Yes, definitely there are clinical protocols very well described, but the way of treating a patient, seeing a patient and describing him the treatment, line of treatment, deciding and describing and prescribing and treating the patient. So it was a very different, the different treating consultants were treating very differently. So I thought there should be a way to run the hospital, to treat a patient and do it in a collaborative manner with respect to the patient, taking a consideration his health, socio-economic condition and the mental status as well while the suffering from a disease. So I was in search to where I can learn these skills. So I personally visited some institutes. That time that was also renowned, just like Symbiosis in Pune. I went to IIHMR Jaipur also, then IMS Indore in Devi Ahilya University, and obviously in Mumbai also. But finally I landed up here in IIHMR Bangalore, and that was a good decision, I think. After my clinical experience, I learned a lot here regarding managerial skills and how to tackle and deal with day-to-day difficulties which we are facing or hospital faces while treating the patients and running the hospitals. And not only the hospitals, because after completing this post-graduation course, I meet Ravi Narayan and Dr. Thelma Narayan. They were a visiting faculty here for public health. So my whole concept changed after meeting them. Quality, I was keen, I was searching for quality. I found it here. I was doing in Columbia Asia Yashwantpur as a training. I did their gap analysis for NABH standards. NABH was a very new thing, quality standards here. So she asked me a question, why quality should be only for a high paying person who are coming and getting treatment in corporate hospitals, big hospitals. Why not for public health hospitals? So that was a life-changing conversation with Dr. Thelma Narayan. So while working with Davita Nephrolife, I encountered an offer from Medica Synergy. So they were doing ISO certification for government hospitals. So that was also related work. Obviously it was a quality, but we were supposed to implement the healthcare standards in government institution and in a primary level, primary health centers, some community health centers, and then sub-district hospitals and district hospitals also. So I thought, yes, it's quality also, and that we have to do it for a common man who walk in for a treatment in a public health facility, and they also deserve the quality treatment there. So what exposure I got here during my teaching and during working in field, there was also alumni was also there. My faculty was also there. Just like we used to taught quality by Dr. Uma Nambiar. She was medical director at that time in Columbia Yeshwantpur. So still we are in contact if I found some difficulty. So now also after passing 10 years, 12 years, I also contact her, madam, I have this type of difficulties, what should I do? So that hand holding still is there. With faculties also, with mentors also, and with alumni also. So this is the best part what I found here.
Okay. I'll move on from what you just said. You said that you're still connected with the alumni.
Yes.
So I would like to know how do you think the alumni network of IIHMR Bangalore plays a role in your professional life?
Very crucial role, critical role. Means suppose we are encountering or trying to solve a problem in a boardroom. We are planning to do something, and we are going to implement that. So what are their experiences? Our seniors' experiences. So they tell us before starting the project or delivering something to the client. We also think what our seniors have done, what our teachers have done, what are their exposure, what are their experiences, and how did they resolve the problems. So that experience is not with us, but definitely with them. So they still guide us. Okay, look, do it in this manner. If you will do it like this or like that, you may encounter these types of problems. So avoid those problems. You should go by this steps.
Understood.
And while changing, it's a very common thing. If you are searching a job, they will help. If there is an opportunity, you are not satisfied in your present job. So that was very small things. That all take care of the alumni. If you want to relocate, you want to change a job, you change a city, and you are trying to establish yourself as an entrepreneur, that also they help.
Doctor, you mentioned that you come from a humble background. So you mentioned that you studied in Hindi medium school. So what challenges did you face while moving to a city like Bangalore? And how did IIHMR Bangalore help you overcome these challenges?
So first
did they help you at all?
Yeah, everything was taken care of. Just like we were from North India. So first problem was of food and then language. So these were all taken care. Our cook was North Indian. They were cooking what we like to eat, and language is taken care of. We are also we were all living in one campus. We are all North Indians there, and conversation was very easy for us. And then my graduation was also in Hindi medium. So I was an Ayurveda student. So there we used to learn Sanskrit also. So far I was good in English, but speaking a lot or writing a professional mail or writing a project, that was not easy for me that time. And also technology also. Writing an email, making a presentation and delivering a presentation, collecting the data, analyzing that. So all these skills were, we were introduced to these skills, and we were trained, hand-holded by our faculty on that time. So that all were taken care of for us.
Doctor, what are you doing currently?
Right now I am working in a FIND. The full form of FIND is Foundation for Innovative New Diagnostics, where we are taking care of 10 government medical colleges. We are implementing NABL standards in their lab, medical colleges lab. And apart from medical colleges, district hospitals, sub-district hospitals, and community health centers also, we are improving the number of tests, particular number of tests in the particular facilities.
Okay, sir. Sir, it was a pleasure talking with you, sir.
Yeah,
thank you so much for your time.